Are you curious to learn about subcostal echocardiographic views and how they assess the normal adult heart and aortic valve? Well, let's dive right in. The subcostal echocardiographic view is an essential imaging technique, especially when traditional transthoracic views pose challenges. To obtain this view, the ultrasound transducer is placed beneath the xiphoid process and directed upward towards the heart. Interestingly, the liver serves as an acoustic window, enhancing the clarity of the heart's structures. Now let's explore the key structures visualized in the subcostal view. First, we have the aortic root, which includes the aortic valve and the initial segment of the ascending aorta. By assessing the aortic root's diameter and functional status, we can detect conditions like aneurysms or dilation. Next up is the left ventricular outflow tract, LVOT, leading into the aortic valve. This structure is crucial for evaluating the flow of blood from the left ventricle into the aorta, particularly in cases of aortic stenosis, where narrowing impedes blood flow. Moving on to the aortic valve, five-chamber view, which encompasses the aortic valve, LVOT, left atrium, left ventricle, and mitral valve. This view is important for assessing the aortic valve's function and structure, including the motion and closure of its cusps. In the short-axis view of the aortic valve, we get to see it in cross-section, displaying its three cusps. The left coronary cusp, located near the origin of the left coronary artery, plays a vital role in directing blood flow. The right coronary cusp, adjacent to the origin of the right coronary artery, ensures proper valve function. Lastly, the non-coronary cusp, positioned opposite the coronary cusps, doesn't have an associated coronary artery, but is crucial for the valve's structural integrity. This view, often referred to as the Mercedes-Benz sign, is critical for evaluating the valve's morphology and detecting abnormalities like calcification, prolapse, or stenosis. Additionally, we have the right ventricular outflow tract, RVOT, and right atrium RA. These structures, located anterior to the aortic valve, are essential for assessing the right side of the heart, with the RA typically visible on the right side of the image. Obtaining clear subcostal views can be challenging due to anatomical variations among individuals. However, adjusting the transducer's angle, position, and applying the right amount of pressure, along with asking the patient to take a deep breath, can improve the view by lowering the diaphragm and bringing the heart closer. Color Doppler imaging is invaluable in this view, as it helps visualize blood flow through the aortic valve and LVOT. It enables us to detect abnormal flow patterns, such as turbulence or regurgitation, which are crucial for diagnosing conditions like valvular stenosis or insufficiency. So there you have it, an overview of subcostal echocardiographic views and how they assess the normal adult heart and aortic valve. With this knowledge, medical professionals can confidently utilize this technique to diagnose and understand cardiac conditions